Hello and welcome to the Arise interview. 60 minutes of big questions about the big stories from the news and beyond with fresh insight and critical analysis. I'm Charles Anyegolu. Coming up in the next hour, COVID-19's continuing grip on the world as the UK, America, Nigeria and the rest of Earth prepare for a major crisis. How are people living life in lockdown and self-isolation? How is the coronavirus changing life and culture around the world? We'll hear personal experiences of isolation as even tighter measures are put in place in many parts of the globe. Plus, as devastation continues to hit businesses as well as the arts and theatres, cinemas, concert halls and other venues go dark, thousands of people are finding themselves without work, but many businesses are employing ingenious ways of keeping in touch with the public. We'll speak with one Nigerian CEO who's become a sort of newscaster. And later, as the pandemic spreads around the world, it's becoming not just a health, political and economic issue, but increasingly, as more countries go into lockdown, a psychological and psychiatric issue as well. We'll talk about the effects of self-isolation on mental health with a psychiatrist who is himself in self-isolation in the UK. Coming up in a moment. Now, to many people around the world, last week and this week might feel like the world has stopped. And for all of us, life has certainly changed. As the global outbreak of the coronavirus shuts down offices and factories, galleries and theatres, restaurants and bars all over the world, people are trying to figure out how to come together and lead as normal a life as possible. In the Washington area of the United States, the former Nigerian presidential candidate, Professor Kingsley Moghalu, is stuck in lockdown in America. He's been reflecting on how his life and that of his family and friends in the US has changed since several states decided to effectively lock down their territories by restricting travel and banning public gatherings. We'll speak to Professor Moghalu on the line from Washington in a moment. But first, let's just remind ourselves of the do's and don'ts in this coronavirus era.
No. Yep. 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 No.
Well, to get his reflections on the lockdown and its political, social, economic and personal implications, I'm joined now on the line from his residence in Washington State by the former presidential candidate, Professor Kingsley Moghalu. Good to talk with you, Kingsley. I hope you can hear me.
Yes, I can hear you. Hello, Charles.
Right. Kingsley, I'm hoping that you can hear me. Just say yes if you can, please.
Yes, I can hear you.
How much of a shock has this lockdown been for you? Does it feel like you're on another planet altogether, not Earth, trapped as you are in America?
Well, the Earth is shut down, but we're still here, quite frankly. It's very bizarre, very eerie experience to lose your freedom, to protect yourself and make sure you live.
Okay, and I suppose the big traumatizing difference for many people is that you are no longer in control and nobody where you are has been since.
Yes, of course. I mean, this is a great pandemic, a great mystery. Well, it's not mysterious anyway to the scientists because we know where it came from. But it has completely changed life as we know it. And here in the United States and around the world, life will never be the same again after the coronavirus, because this is something that has overpowered the strongest army, the strongest government, the biggest and healthiest economy, and poor countries as well. So the race is on to find a cure, to find a vaccine, but all that will take many, many, many months. And until then, what happens? I am on lockdown with my family here in Washington, in the Washington, D.C. area. We don't go out, and we take extreme precautions. And we, of course, keep our eyes on the news to see what's happening. It's terrible what's going on in the United States. 35,000 people with the coronavirus here in the U.S., and about 500 of them have died. The epicenter of the pandemic here in America is in New York City, where about half of that 35,000 people are located based on testing results so far. Around the world, we know about 350,000 cases are confirmed, and about 15,000 people have died. We also know it's horrible in Italy. In Italy, it killed so many people, and one of the reasons is because Italy has a very high percentage of population who are elderly, and we know that it's very, very hard on the elderly, this disease.
Well, if you might oblige us, Professor Moalu, if I could ask you, I mean, it sounds as though because you're not coming across as very clear on the phone here. It sounds as though you're speaking on your speaker phone. Would you be able to talk directly into your phone rather than on the speaker phone, and hopefully that'll improve the line? Although, fear not, we've been hearing what you're saying, but we want it to be even clearer. And just moving on, it looks like the governors in the US are leading the fight against the coronavirus outbreak in America. I mean, they seem to be asserting themselves more seriously than the White House. What's your take on that?
Yes, indeed. We've seen a lot of political tension in the U.S. Federal government, the president, the White House, and the public. Tension between the federal government and the state governments who are overwhelmed and calling on the federal government for help. And they feel that supplies are not arriving fast enough, testing kits are not enough. There was a bit of a delay in the response from the White House in the beginning. Of course, in the last couple of weeks, they've gotten very serious about it, but there are a lot of Americans who feel that the pandemic was not given the seriousness it deserved early on when it broke out in China. So the states are really the ones bearing the brunt of everything, and the governors. And they complain because they say they're competing against themselves for supplies that are scarce. There's, of course, a lot of price gouging going on here in the United States, not just in Nigeria, I can tell you. Masks that are manufactured for the equivalent of 8 cents are selling for $4. So the capitalist instinct there is very strong everywhere. There is also a problem that many states are having, that, hospital infrastructure, because of the number of cases that are estimated to be coming on in the next few weeks and months, that the hospital beds are not enough. So the question of hospital beds is also a huge problem for many state governors in the United States. In Washington State, especially, and in New York State, it's a huge, huge problem.
Let me ask you this from a political point of view, because you are, of course, a politician. Donald Trump, at least, in spite of the criticism, is visibly leading the fight against the virus, appearing on television every day to hold briefings. What is your sense of how President Buhari, who you ran against in the last election, President Buhari in Nigeria, is taking charge of the country, of the crisis in his country?
Well, yes, you're right. President Trump briefs the press every day. And, of course, that's very important. He gives at least 2 hours every day on the coronavirus briefings. And I think we have seen that also in various other countries, not necessarily on a daily basis. But when it comes to taking charge and leading from the front, I have been surprised that President Buhari has not led by the front. From the front on this matter. And it took a lot of criticism before I think he gave an address yesterday or so. And his presidential aides were criticizing senators who called for him to come out and speak to Nigeria. You see, there is something to be said about leading from the front. It is what gives the country confidence that they have a leader. It is what brings the country together in a time of crisis. We saw Abraham Lincoln do it. We've seen many world leaders step up and speak to their country in a way that gives them confidence and hope while taking the necessary steps. The Nigerian government has made its efforts. I would not speak down on those efforts. However, they need to do much more. And it's very important that President Buhari, demonstrates a stronger level of leadership than what we have seen.
You don't detect clear, decisive and active leadership on his part. But what about the competence and experience of his foot soldiers in dealing with this? Do you detect competence and experience there? For instance, the Minister of Health, who's been doing daily briefings, the Centers for Disease Control?
Yes, undeniably, yes. The Minister of Health has been doing a strong job. The Director General of the Centers for Disease Control, Chikwe Ihekwazu, who used to be a colleague of mine many years ago in the World Health Organization at some point. I think they're doing a good job. We have had experience with Ebola in Nigeria. And because our health systems are extremely weak, the Nigerian response to these kinds of pandemics has been very proactive, especially through contact tracing, testing, contact tracing. So I think they're doing a good job, but I think they need to do much more. I saw the committee that was set up by the president, headed by the secretary to the government of the federation. And I noticed, for example, that the National Security Advisor was not a member of that committee. This is a national security issue. So why would you set up a committee and the National Security Advisor is not there? So, I think there are gaps in what's being done, but there is no doubt that there is a very strong effort within the limits of the capabilities of the Nigerian state, because the Nigerian state is not a very strong state when it comes to managing risks like this. The investment in healthcare and education, human capital, is very low, extremely low. And this is one of the big lessons out of this crowd. Risk management capacity is also not very strong. But they have strong health professionals, no question about it.
Right.
But again, look at the fact that at a time like this, doctors in Abuja, I read a report.
Kingsley, I'm really sorry to interrupt you, but we must take a break now. It's great talking to you, Professor Kingsley Morlu, there on the line from Washington. You're watching the Arise interview, plenty more still ahead, including we find out how some businesses are employing ingenious ways of keeping in touch with the public in the era of COVID-19 social distancing. Stay with us. Welcome back to the Arise interview. I'm Charles Anyegolu. Now, in most parts of the world, it's the start of another working week in theory, because few countries, if any, are operating normally. As the lockdown deepens, many people are starting to feel a bit stir-crazy from staying indoors for a long time. Well, enter the internet and loads of apps, pocket casters and innovative ideas on how to stay informed and entertained if you're stuck at home. And Nigeria isn't left out. icreate Africa is a hub for skills, excellence and development in Africa and beyond that brings together young people. But since the arrival of the pandemic and social distancing, they've had to think again about how to do this. Take a look.
What's up, people? It's BrightJaja. I remember earlier I said something that I would be starting a show called Live With. Now, I'm sure you're asking, what is that about? I already told you. This Sunday, I'll be going live with my brother, the GOAT, the youngest House of Representative member in Michigan and the youngest lawmaker in America. He's an army, a state guard, a police officer, and a deacon, a senior deacon in his church. Amazing young man. I can't wait to go live with him for him to share his story and share his experience and inspire you guys. So, if you're into politics, if you're into business, you have to tune in on Sunday, 9 p.m. Listen, Sunday, 9 p.m., you better tune in and listen to this brother, this mentor, share his story and inspire you. I'm sure you guys are going to be at home anyways with the social distancing thing.
Well, let's speak now to the man in that video, the CEO of icreate, Africa BrightJaja, who joins me in the studio at a safe distance, I might add. How are you?
Good, thank you so much for having me.
And of course, all this, you're trying your hand at, being an interviewer, newscasting, all of that, but then I suppose that's the whole point of your business is innovation, entrepreneurship, and adapting to situations that you find yourself in.
Yes. I think this whole thing started when we found ourselves in a space where we couldn't do our normal project, which is organizing a skill competition, bringing young people together, bringing all the other stakeholders from the employers to come and engage with the young people and get them jobs. And with the situation, we can't actually do that anymore. And we just thought about it: how can we still inspire those young people? How can we leverage on technology and social media to still get our word out and still get the ball rolling? And we just noticed that, we can actually use Instagram. We can use Instagram Live. We can identify young people or people who are doing amazing things in their industry to just come on our live and share their story and inspire other people and let people understand that, at this point in time, it's not a time where you give up. It's the time where you innovate, where you think of another way. There are 1,000 ways to get things done. So if this way is not working, you got to find another way. How can you leverage on technology? How can how can young people play a role in this time to change the system? And that was the competition yesterday. I had Joel, who is a state house representative in Michigan, and he came and shared the story, his journey, and also we talked about when it comes to this time where we can't really do so much, and a lot of young people are at home and they are not doing anything. How can we find solution? How can we navigate this time to see how we can create solution for businesses? How can we create solutions for people? How can we engage people to a point where they can get services? And it was a great conversation. We actually planned to do it for 15 minutes and we ended up doing it for 2 hours. It was really awesome.
Well, that sounds like you enjoyed it. Actually.
Yeah, I had fun.
But at the heart of that is a sort of corporate responsibility that you're saying to people, we really must do what we're supposed to do to keep this disease at bay.
Just looking at the entire situation for me, it's just bringing me to understand and just reminisce about what we would have done before now. It's amazing how everybody's coming back home right now. And a lot of people that are like, no, I can't stay in Nigeria, I can't live in Nigeria, they're all coming back home right now. And there's this word that my dad always says that just keeps playing: the way you lay your bed, that's how you're going to lie on it. We've never actually focused on improving our health infrastructure. So now the former vice president's son has the virus, and they have to send him to Gwagwalada, not UK. Right. So imagine if we had invested more in our system, if we had, everybody that had the opportunity or had the fund and the finance or the people in power, instead of going outside the country to get treated, if they had invested more in our health system, it would have been a better way for us to, tackle this. So it's always brings us back to your home is the only place. You can go anywhere in the world, but your home is where you're always going to come back to.
You've got to improve your home.
You've got to improve your
basically.
home. It's something that you can't live without. So for me, that just brings me to understanding now that how can we make sure that we prepare our home for the next generation? And the young people has a major role to play. We understand this time. We understand technology more than anybody else. How can we leverage on artificial intelligence and data analysis? How can we use that to make sure that we're able to deliver services, to make sure that we're able to get people to, even if they can't leave their house, how can they still get quality service and still get the economy going regardless? And so what we did yesterday was, while we were having this conversation, we came up with an amazing idea where we decided to create a platform where all developers, because right now, for you to leverage on technology, you have to have the developing skills, the coding skills and all that. So we're like, how can we get developers from across the world to come into one platform and let's sit down, think, and develop different ideas that we can use to solve problems across the world. And we just put that out recently, and we're just calling on creators who are in the technology space to come on board. Let's create an online forum where we can have conversations on, okay, when it comes to health, what can we do technologically? When it comes to to finance, what can we do technologically? When it comes to food, and when it comes to agriculture, what can we do technologically to leverage and make sure that the economy keeps going regardless? And that is, we've gotten a huge pull from yesterday till today, and we're still putting the word out to get more people from across the world to join the platform and just come up with ideas on how we can solve the problem.
Yeah, because the next question I was going to ask you is, are you finding that people are popping up from around the world and getting into your connectivity as you become a provider of that sort of material?
Yes, I mean, it's not just inspiring. It's not just something that we just did because we felt like, okay, this is the solution. It's for us to inspire people. Yesterday, we had about 500 people that came online. And just after that, yesterday, we saw like a lot of people were going live. A lot of influential people, like Audu Mekori was live the whole day today. And just, getting people on his live to talk about the virus, to advise on, measures and ways to get people, going. But at the same time, beyond communication, there has to be action. So how can we create a system that can still make people act and still be able to add value without just saying, okay, yes, we have to communicate, but when it comes to running an office system, there's communication, there's documentation, and there is delivery. How can we have those three aspects, work regardless of, not having to engage, but still have those systems in place?
But beyond, of course, doing what you're doing,
yes,
which is very commendable,
yes,
and in the current sort of environment, I mean, how much is this hitting your business? Because a lot of it depends on, meeting and communicating with young people, doesn't it?
I think we were kind of ready to a point, I think, because last year we did the competition a couple of times and we got a bunch of people into our platform. So we created a technological platform already. And this year we wanted to perfect the technological platform. So we have a platform where everybody that's gone through our competition have a skill profile, right? Our business is something that we can actually leverage on technology 100%.
Right.
So what we have to do is now have every single person build a skill profile on our website or on our mobile application. And then if you need a plumber, you don't have to leave your house. You just have to go to our platform and get a plumber that would come to your house, fix what has to be fixed, and go back to his space. So right now what we're doing is we're expanding. We already had that platform, but now we're expanding and we're working on it to make sure that it accommodates more people. And I think for us, that's like the best thing that we can actually do right now. And also we're looking at actually organizing the competition online. So, but mostly focus on digital skills. So we might not be able to do physical skills like hairdressing and barbering like we used to do, but we can do graphic design, web design, virtual reality. That's one major thing I actually want to talk about. That's one aspect that we can leverage on. We can actually host events on virtual reality system. So if you're able to see how you can get those devices, you can actually attend concerts, go to cinema halls by just wearing the VR set. So we want to also leverage on that because that's probably the next thing that people are going to be dashing onto when it comes to social media and communication.
Yeah, but that's a very good point because obviously we don't know how long this is going to last, and people could be going absolutely bananas by the end of it. We're going to be talking to a psychiatrist on this program, but here we are in this situation that none of us as human beings have ever been in before.
Yes.
Do you think people are going to be in a really bad way at the end of this when they finally let them out again into bars and pubs and sort of clubs? Do you think people would have survived socially?
I think we're humans and we adapt. That's one thing that we're good at. I think we're going to be able to go through these challenges and come out really strong. And when we find ourselves out of it, we're going to be more careful and we're going to be more cautious of our environment. I think this is a kind of a wake-up call.
Yeah, but that's exactly the point, because you're talking about introducing things like virtual reality, cinema, and all that sort of thing. Do you think it's going to fundamentally change the way people operate socially?
That's already changing the system even before this happened. I have a Quest, a VR Quest, and that's how I watch all the games. I'd rather watch the NBA finals on my VR Quest than being that.
But it's a little bit different when you know that you cannot go out.
Yes.
You see what I mean? Because you've got the option of going out. That's a different thing.
Yeah, but it's just like social media. People, when social media came out, there's a lot of people that were staying indoors than actually going out, because now they can reach out to everybody and they spend more time on their phone. Even when they go out, they actually spend more time on their phone. The technology is already moving us to that. What we're experiencing right now is a fast forward. But at the end of the day, we're going to get to a point where people are not going to be going out anymore because they have a virtual reality set, they have an augmented reality set, they have people. There's going to be a whole virtual mall where you can buy stuff. Like, that's where technology is already taking us to. So right now, what this is doing
is going to accelerate.
It's just accelerating. Just okay, yeah, you have to create that system now. Like, the future is now. So do that right now. You know, so I think with or without, we're going to get there, at some point, and this is just going to fasten the process of us getting there.
Right. Okay, Bright. I'm going to ask you to stay with us because we're going to go to the UK to talk to a number of other people. But do just stay with us.
Okay.
You're watching the Arise interview. Plenty more still ahead, including we'll be on the line to rural England, the county of Hertfordshire, to find out how one environmentalist is coping with the effects of self-isolation. Stay with us. Welcome back to the Arise interview. I'm Charles Anyagolu. Around the world, people are slowly adjusting to this strange new reality that has enveloped the globe. News of one restriction in one country is followed by news of another, with the requirements becoming ever more stringent. Everyone is wondering what the short, medium, and long-term consequences will be, each of us weighing the dangers to ourselves and those closest to us, as well as the community we live in and the rest of the world we share this planet with. It's like some sort of post-apocalyptic science fiction diorama. But even that is not a fitting description because, quite simply, there are no precedents, although there are parallels to be found in the year 1665, when London was laid bare by the bubonic plague and households were sequestered and pubs closed. But of course, the times are so different now that there aren't many lessons to be learned from 1665.
For a moment, rewind our lives, say to last week this time, or last month. Can you see how things have changed in just a matter of days and weeks? Institutions and entertainment centers have closed down. Public spaces are empty, there are fewer cars on the roads, pollution levels have come down, tourist spots and beaches are empty, water bodies are cleaner, because most people are at home with their families. This coronavirus pandemic has hit the reset button on a lot of things. For starters, we've begun appreciating old values and simpler things in life. But I want to focus on one issue tonight, and that is coexistence. Since humans began retreating from public spaces in fear of the coronavirus, nature has begun reclaiming its space. Dolphins have returned to Italy's coast, thanks to the missing cruise ships. Look at these images. There are swans in Italy's canals which are otherwise populated with gondolas and tourists. The birds have returned. In Singapore, otters are roaming freely thanks to the empty public spaces. A bunch of Egyptian geese were spotted crossing the tarmac of the Tel Aviv airport in Israel. They could walk freely, as you can see, without fear of human intervention, courtesy the grounded flights and the travel restrictions. Chicago's Shed Aquarium is closed to visitors, but it made an exception for Edward and Annie. The rockhopper penguins had a blast visiting their friends. For a change, there were no humans to disturb the pair. Look at them. These images are a grim reminder of how we humans have taken over the earth. We've encroached on the territory of other living beings. We've destroyed habitats, killed animals, overused resources. We do not own this planet. We share the world with a lot of other living beings. Our lives are as much about cohabitation as about survival of the fittest. We humans cannot be bringing down forests, destroying habitats and polluting oceans, putting the survival of other species at stake. These dolphins belong to the waters of Italy. These swans belong to the canals. It's their home. Let the coronavirus crisis leave us with this lesson. Learn to coexist, or nature will find extreme ways to reclaim its space. Think about it.
Salutary lesson there. Well, for more on the effects of self-isolation in rural England, I'm joined now on the line from the county of Hertfordshire by the environmentalist Jacqueline Bell. Thank you very much indeed for joining us. Just take us inside where you are in the UK and show us what life is like for you during this unprecedented lockdown and self-isolation. You're not quite in lockdown yet, but you are in self-isolation.
Yes, hi Charles. Yeah, you're absolutely right. I'm actually into my second week of working from home, and I have to say it's actually quite a surreal situation. You can hear and see sort of on the media everything that's going on around you, but I'm actually not directly involved like all of the hospital workers and so on who must be facing a terrible time at the moment. But, I'm trying to keep myself from going mad here. I'm trying to stick to a routine. So for me, obviously, a routine is what works best for me, and it's going to be different for everybody. But I make sure that I try and get up at the same time as I used to when I was going to work. Have my breakfast, have my shower, and most of all, I'm not staying in my pajamas all day, because there's always the risk that once you start doing that, then you do start getting a bit confused exactly as to what your purpose in life really is all about. But it's a difficult thing to be in, but this virus is serious and it's a necessary thing to be doing.
Well, thank you for giving us that brief insight into your life. We appreciate it. But, what about people generally around you? Are they understanding that this is the new reality? Are they learning to slow down and be still?
Well, I think it's a case of having to, at least in the workplace that I work with. I think there's still a lot of ignorance and selfishness out there. For example, I did have to actually go to the grocery store today, and there were lots of people out still buying, emptying all of the shelves, which is absolutely a ridiculous thing to be doing. There's enough food and supplies there for everybody, but just take your own share and don't sort of be that selfish person and stock up so much that the vulnerable people and the hospital workers are left with nothing. But certainly in my own workplace, generally people, it's a new way of working. We're all trying to find this new way of working. We're using online technology, obviously having our meetings over what's called Teams meetings, so we're all able to see each other face to face. So we're getting on with the normal routine of work, but it's certainly a new feeling. For those people that are living on their own, it must be extremely difficult, but also for families, because all of a sudden you're thrown into living with your family 24 hours a day, 7 days a week, with no break from each other. So that in itself is a difficult thing. And no doubt, though, in 9 months' time, there's going to be a spike in newborns, a spike in divorces, and also, I'm afraid to say, there's probably going to be an increase in mental health issues. So during this period, it's very important that you do look after yourself, that you make sure that, you're doing some exercising, that if you do go out for a walk, practice social distancing so that you are not with other people that perhaps may have the virus and don't know about it. So, you must look after yourself because this thing is serious. So take the advice from the government, social distance, wash your hands, use sanitizer if possible, don't touch your face, sneeze into your elbow, but please be careful. At least in Nigeria, you're at the beginning of this virus situation, so take the advice. Don't get into the situation that the rest of the world is currently in.
That's very, very good advice there, Jacqueline, and we appreciate it. But from the point of view of you as an environmentalist, is there a sort of time-out situation here, given that we've all worked traveled and possibly consumed too much. I mean, we're watching that video earlier of the space. You probably couldn't see the video, but you probably could hear it. Of what is happening in terms of nature and the fact that dolphins are returning to the Italian coast. I mean, geese are crossing the airport in Israel, being able to reclaim a space that's been dominated by human beings. Could this devastation carry a hidden meaning that is not simply one of tragedy, but of hope for the world?
Well, yes, actually, Charles, this is actually probably the byproduct of what this disease is actually causing, and it's, allowing nature to come back again. So it's giving the world a break. It's giving human beings a break as well, because I don't know about you, but every single day I feel like I'm a mouse on a little spinning wheel. I'm just constantly stressed about work and about just things of day-to-day living, and this is kind of slowing us all down and letting us take stock of what's around us, about the relationships that we have with each other and with the environment. So if there is something good that comes about this in our race as a people, of looking after each other, caring about our environment, caring about our community, then that's a good thing. It's just sad that this is what's having to happen in order for us to think about these other things. But certainly, it's good to see that nature is rebounding. I just hope that after all of this comes to a conclusion, that we've learnt lessons from it and perhaps implement new ways of living, new ways for us all to work together and to help our environment and to help ourselves.
And we're almost out of time, Jacqueline, but as you take all this in, is there also concern that amid the news of overstretched hospitals and the chaotic situation in intensive care, medical staff may not be able to cope, and that should, heavens forbid, the disease was to come close to you or your family, the hospitals may be too overwhelmed to provide the necessary care?
Well, yes, that is obviously a worry for all of us. The hospital workers are on the front line, so to speak. It's really tough for them. I saw something the other day where a nurse had worked for a 48-hour shift. I mean, can you imagine that? And she was basically brought almost to tears because of the stress that she's under. So these hospital workers, I mean, they're doing an amazing thing. They're amazing humanitarians looking after us all. And we have to practice all of these initiatives that the governments are putting in place so that we can help those workers out. That's the only way that we can help the hospital situation and to help our loved ones.
Jacqueline, thank you very much indeed. Jacqueline Bell there, the environmentalist, talking to me from Hertfordshire in the UK. You're watching the Arise interview. Plenty more still ahead, including we'll assess the impact of the coronavirus lockdown and self-isolation on mental health. Stay with us. Welcome back to the Arise interview. I'm Charles Anyekolu. Now, to say that COVID-19 is wrecking lives and the economy is an understatement. But according to the experts, it's also on the cusp of causing a mental health calamity across the world. For all the joking and jiving on social media, there is a dark side that they warn is going to explode soon enough. You can be as busy as you like at home, but those four walls eventually close in during the working day. Depression is likely, the body suffers from lack of activity and engagement, and there's a pining for the outside world and your routine and friends you haven't seen. Suddenly, a mundane bus ride seems exciting. The long-term damage that protracted isolation causes is well documented, to say nothing of the noted effects of excessive computer use, lack of exercise, absence of sunlight, and indulgence of a sedentary life. The experts are warning that extremely distressing and wildly unpredictable circumstances coupled with social isolation are the recipe for an unmitigated health disaster. If we can't leave our homes, if we're encouraged to stay away from our doctors' practices, there's a time bomb that will go off, and the price, they say, may be catastrophic. With more on this, I'm joined now on the line from his home in London by Dr. Warwick Onyama, who is a retired psychiatrist and who is himself in self-isolation. Dr. Onyama, thank you very much indeed for talking to us. First of all, on a personal level, how are you dealing with the reality of this self-isolation? I mean, is it suffocating? Is it frightening? Because, I mean, this is something that is completely unknown.
You're absolutely right. Well, at the moment, I'm coping with it reasonably well because I'm trying to organize my time and to make notes and to lay out timetables and schedules for how I'm going to use this unaccustomed availability of personal time that has followed on the government's recipe for self-isolation. But I cannot tell you what I will feel like a week from now. By then, I may have started gibbering. We shall wait and see.
Well, I don't mean to laugh about that, but it's just the way you put it. But of course, for some people, Dr. Onyama, the lockdown is a little more dramatic than for others. I mean, for women, for instance, you know, and men as well, if you have children or if you have a violent partner, for example, or pets or, you know, people with mental health issues, you know, you're stuck indoors with them, aren't you? I mean, entire families confined to one space.
Well, there was a visual joke doing the rounds on social media in which a healthy-looking man was asked, given the option of A, staying at home with your family and children, and B, and before they could go any further, he said, I'll take B. So yes, it is suffocating, and there are many people who will find it hard to endure. It is a bit like being in prison, in fact.
Yes, I think that's a very good analogy there. But I mean, from your professional point of view as a psychiatrist, I expect there'd be a mental health element to this lockdown and self-isolation, some measure of psychological stress that comes from being home all day.
Yes. I think what you will find is that there are certain conditions that will accelerate, as it were. For instance, states of abnormal anxiety, which are part and parcel of daily life for some people, will be exacerbated by lockdown, as indeed will be the tendency to obsessive, compulsive, repetitious rituals that afflicts certain people. They will become more pronounced, particularly with the prescription for frequent hand washing. That's already an affliction that many obsessive compulsives have to manage. And once it's prescribed by government, keep washing your hands, they will sort of spend the entire day washing and re-washing their hands every time they go anywhere near any object.
And I mean, in terms of the forms or other forms of psychological stress, I mean, would it be, you know, mood swings alternating between a sort of panic mode and feelings of resignation, you know, at being home all sort of day?
Well, you see, whatever condition the person is predisposed to, and mood swings are one and depression is another, will in fact be exacerbated by any unusual state of confinement. So for those who are prone to mood swings, they will have greater swings. Those prone to depression, they will have deeper depressive episodes. What we don't know yet is what this particular lockdown is going to result in. We are yet to see, as it were, the psychological fruits of this particular confinement.
Yes, absolutely. And of course, in terms of emotional support, Dr. Onyama, I mean, anybody who gets the disease is essentially alone in hospital. The doctors and nurses are the ones who are there to hold the hands of these people while they, in effect, die because their families cannot be with them because of the threat of contagion.
Well, that is absolutely right. It's a fairly extreme example because apart from anything else, and I'm not sure about Nigeria, but certainly here in England, and particularly in London, you have what they call designated helplines, and those numbers are made available over the media for people that are told, if you're feeling X, Y, or Z, if you're feeling distressed, if you're feeling ill, contact NHS 111, for instance. So there are helplines, contacts that people can make if they have to.
And just from a personal point of view, Dr. Onyama, given that you're observing the whole issue of social distancing and so on, I mean, how controversial is it being? I mean, because it seems like a lot of people are simply ignoring the advice that they're given, including
You're
in the
absolutely
UK.
right about that. In fact, the government is now considering rather more extreme measures to enforce, as it were, social distancing. And for the benefit of your viewers, the recommended distancing is 2 meters or 6 foot 6 inches between you and every other person that you encounter when you're out of doors. So, yes, and, you know, people are crowding on buses and crowding in trains. That's not on. What the government is probably going to have to do is police train stations, police buses to ensure that social distancing is maintained according to what is prescribed.
And just for the moment, we've got about 30 seconds left. What is your sort of final word on this as a psychiatrist yourself and someone who's a doctor?
Yes. Well, I would say find things to do that keep you occupied. And I believe in planning one's time, planning one's week, endeavoring to see what you can do that's of interest and spending time doing those things.
Dr. Warwick Onyama, I want to thank you very much indeed. Dr. Warwick Onyama was talking to me there from his home in London. Well, that's it for this edition of the Arise interview. Do join us again tomorrow from me and the entire team here in Abuja and London. Bye-bye, and thank you for watching. Not forgetting America, of course. Bye-bye.